Good morning. Welcome to the COVID-19 weekly media briefing. I'm Carrie Schutte, the Public Information Officer for Shasta County Health and Human Services. Today with us, we have Donnell Ewert, the Director of the Health and Human Services Agency, Dr. Karen Ramstrom, she's our Shasta County Health Officer, and we can't see his smiling face, but with us today also is Matt Pontus, who's the CEO of Shasta County. We'll start with the numbers. Today we have a total of 553 confirmed cases, including 8 from Monday. The new numbers will be coming out a little bit later this afternoon. We have done a total of 33,334 tests. 29 people in isolation, another 179 on quarantine. We have 3 in the hospital, 2 of whom are in the intensive care unit, and we have had 11 deaths at this time. Do any of our representatives have anything they'd like to start with before we go to media questions?
So, Carrie, yeah, I just thought I would just quickly let folks know that over the last week or two, we've been working really closely as schools have reopened to assist them in being safe in the way that they have implemented their new plans, and to assist them in the event that there's a student who comes to school who's diagnosed with COVID-19. And so we've had a few of those instances where the schools have responded quickly, and we work together to exclude those children and their contacts. And so that process seems to be going well. Big thank you to the schools for all of that work. I know it's a new burden that they're undertaking and doing a great job. And so we're continuing to learn as we go, but it seems to be going well now. At this point, and we've had no instances where we've had transmission within a school, and so that speaks to our rapid response. It still could happen even with these few cases we have had so far, but so far so good. So I think that's the only update I had today.
All right, thank you, Dr. Ramstrom. Anybody else? All right, we are ready for media questions.
Well, I have a question for Dr. Ramstrom. You were talking about the tiered system from the state. When is that supposed to come out? What is it, and what could it mean for us? I guess that's 3 questions, but.
That's okay. So we're hoping it comes out late this week. That's what we're told, but that is yet to be determined. We know the state is still working on a lot of the details. We have some information, but I think some of that's still being fleshed out. So our understanding is it's going to rely on a smaller number of metrics. So it's going to focus on case rates and test positivity rates, and then use the other contextual measures such as your hospitalizations, your ICU capacity, to make decisions about the scope of what different industries are, how they're opening. And so it sounds like it's going to be 4 tiers, and we're not exactly sure what's going to be in each tier. And it's going to hopefully relieve that on-off option, and it'll have more of a range of being able to be open to a different extent instead of just being on or off, open or closed in terms of different industries. So that's kind of about what we know right now. And we have a call with the state later today, hoping to learn more, but I think we'll have more details when it comes out in writing, hopefully late this week. And as far as benefit to us, I think it will give us more flexibility, I'm hoping, in terms of how we can help businesses to be open safely and the scope of what that looks like versus just not being open for those industries that we feel can safely do that at this time. And we were pretty close to that until the mid-July shutdown statewide. So we're hoping that we can kind of get back to where we were with this new tiered framework.
Will it give the county more flexibility rather than just getting the edict from the state?
I believe so. I think there will still be communication with the state. We don't really know what that will look like. But that's our hope. It's yet to be determined.
Thank you, Doctor.
Other media questions?
I have one. Can you hear me okay? I have pretty spotty internet.
We do. We
Okay.
can hear you, Don.
Thank you. Thank you. I have a question regarding the Sprouts program. And I saw some videos where a lot of people were coming into stores and showing an exemption card. I'd like to know how much weight those exemption cards carry in terms of businesses that require masks. So the exemption cards would exempt them.
So Donnie, you were cutting out a little bit, but I think I heard your question. So, when I've talked to some primary care providers in the community, maybe that's happening, but I've heard some say that that's just not something that we do. And so it's not something that we've been involved with making any decisions around as far as what that would look like and what weight it would hold. So I can't speak to that in detail, but I do know some providers have mentioned to me that that's not a business that they really want to get into. So our hope, I think, is that a person would be able to say to whatever entity they're entering, to say, I'm not able to do this because I have asthma, it's acting up today. But I don't know about that. We haven't been involved with putting any kind of parameters together or a program for getting exemptions approved or anything like that.
All right. Any other questions?
Yeah, I have one. Mike Chapman from the Record Search Site. Dr. Ramstrom, you mentioned how the department is working with schools when there's a COVID case. We've heard of COVID cases in Anderson High School and Enterprise High School. Are you able to say other schools that public health is working with right now?
Right. And so we try to give the school the opportunity, we want to make sure that they have the opportunity to share that information. And I believe all 3 schools have done that. And so the third school was the North Valley Continuation High School. And so just to let you all know, kind of what we've worked out with them is we've provided, had conversations about what that would look like if they have a case. And, all of us agreeing that we want to be proactive in sharing that information so that they would notify the school community what's going on and what actions they've taken, and if there's anything specific to that family's student that's in that school setting. So those are the 3 that have been involved so far.
Okay, thank you.
I have a question. I had heard that some restaurants had been shut down because they were violating the indoor dining rule. Were those actions taken by by public health or by ABC, or what entity was it that ordered those actions? Do you know?
Well, that was the state agency, the alcohol beverage control officers that conducted that action. And I will add that they had visited and done education and had not cited anybody on the first round. And then they went back for a compliance check and found that things had not changed. And so that's when the restaurants were cited.
Was it just the one, or do you know how many have been cited? Have you heard about ABC doing that at other restaurants?
Yeah, I'd refer you back to ABC. I think they would be able to comment on that more specifically and accurately.
Okay, thanks, Donnell.
Any other questions?
Well, I've got one for Donnell and Dr. Ramstrom, either one.
Okay.
You're facing a weekly barrage of criticism at board meetings. Is that accomplishing anything? Does that help, hurt? Your reaction to that?
Thank you for that question. I just want to repeat what I've said before, and that is that our local health officer has not instituted any restrictions on businesses over and above what the state of California has. We are merely implementing the interventions of the state of California as we are required to do. Shasta County is a subdivision of the state of California. And so we understand people are frustrated. We understand there are impacts of these measures on businesses, on families, schools, etc. But you know, we also our job is to control and contain a dangerous and deadly infectious disease. Many of the comments tend to imply that health is all our individual responsibility. And while that is partly correct when it comes to healthy eating, exercise, how fast we drive our car, whether we put on seatbelts, etc., that is not the case with infectious diseases. And in fact, public health kind of got its start many decades ago, working in communicable disease control. And I know we are sort of victims of our own success. You know, there's been so many diseases that have been eliminated or almost eliminated due to vaccination, sanitation, and various control interventions. People are not accustomed to this anymore. The fact that we, you know, are quarantining this number of people. I mean, I've been in public health for 32 years, and you know, this is the first time I've ever been part of doing this on a widespread basis. So this is novel to many of us who are alive today, but in the past, this was quite common. And so it's hard to get used to. And I also mentioned at the board meeting yesterday that disasters are difficult. And when we have disasters, they tend to be fires, and those happen, and then they're over, and then we can get on to rebuilding. And I think the fact that we have this prolonged disaster of a pandemic, a worldwide pandemic that none of us asked for or wanted, is very difficult. It's very difficult to get used to. It's very difficult to accept that we've got to alter our behavior for an extended period of time. But I do think the vast majority of people in our community grasp the concept. They are more than happy to wear masks in public places for the brief period of time that they're there. If you go out in the community, you see widespread compliance with that now. People are getting used to it. Our businesses, for the most part, have been fantastic in implementing changes to their business practices and enforcing the state's mask mandate inside their businesses. So I think it's easy to point out the few people who, you know, have kind of an extreme reaction to these interventions versus the vast majority of people who have come to a point of acceptance. So I think public health, again, is acting on behalf of the whole community. We are responsible for all 180,000 lives in Shasta County, and our actions are intended to protect the whole population, not focused merely on a few people, you know, who seem to think that everything they want should come to pass.
Thank you, Donnell.
Other media questions?
Dr. Ramstrom, over time, as we've learned that the spread of COVID-19 is primarily from expectorating droplets into the air, have we also learned that surface contact is not nearly as much of a factor as it was initially considered to be?
So I haven't seen any updated information on that recently, but we do think that that closer contact when a person is most highly infectious in the first couple of days of being infected, that those droplets, when somebody speaks or yells or coughs or sneezes, if a person's close by, that's most likely how that transmission happens. A lot of times this is in households so that you have more prolonged opportunities to be around each other. I'm sure that there is some transmission from a surface contact, but I don't, I think that we're more concerned about that close contact. Both are important, but definitely being close to somebody when they're highly infectious, certainly for a prolonged period of time, is probably the riskiest exposure that can happen.
I was wondering mostly specifically about the exchange of money. A lot of businesses that are taking a lot of precautions as far as face coverings and so forth. That seems to be overlooked, the exchange of money, which seems just filthy to me.
Well, and that's why hand hygiene is so important. And so hopefully those cashiers are using hand gel and washing their hands frequently, or using gloves before they, in between. So it's all of those measures are important together. I don't know that we have documented evidence of a lot of exposure by exchange of money, but anytime in a retail establishment, when somebody's doing that work all day long, hand washing is probably one of the most important practices for them to have in place, in addition to the face covering, eye shields, plexiglass, that kind of thing.
Okay, thanks. Fortunately, I don't buy a lot of stuff.
Good call.
I did just want to add a little bit to Donnell's comments and in response to your question, Mike. I guess I would just like to see us move in a direction where we're all in this fight together against this virus. That's who our enemy is right now. And, I think that we're moving in the right direction, and we have a lot of our businesses have done a great job with their modifications. We do know that we did backslide a little bit just based on the most recent closures, and we're hoping that we can reverse that sooner than later. We're all of the same opinion. But those modifications in the businesses that we all frequent are going to have to be in place for a while. And I think it's going to be up to all of us to just kind of do our part and wear the face covering when you can, when it's appropriate for you based on your own situation, and definitely keep our distance, and to have our businesses implementing those modifications so that their workers are safe, and our community members when they visit are safe. So that's where I hope that's the direction we're going, where we can all be in that together in this fight against this virus.
Thank you, Doctor.
Any other questions? All right, seeing no green lights, I will thank you all again for your time, and everybody have a safe and healthy week. We'll see you next week.